To get into how the thoracic spine moves and why these exercises are going to help, as well as the exercises that are going to help kind of open things up. Hi, my name is Stephanie. I'm with Empower Physical Therapy, and we help clients avoid surgery, injections, and medications, but also getting their life back. Most of the time, people have had failed treatments and multiple other healthcare providers, and they were able to get some results coming to our office. Now, when it comes to the thoracic spine, why is it so important? The thoracic spine is something that we don't even realize that, you can have issues in your thoracic spine that cause headaches, that cause shoulder pain, that cause pain between your shoulder blades. There's a lot of things that we treat, that we always go into the thoracic spine to see if there's an issue there that starts giving people resolution. Now, when you come into my office, we do a lot of manual work so that we can get those ribs to kind of move. And it works really well, really fast, but you guys aren't at my office, so what are some exercises that we can do? And that's what we're gonna talk about today. So when we look at how the ribs move, so our ribs wrap all the way through here. So they're in the front part and they wrap all the way to the back part and attach into the spine. And so when we think of how we move, so if these are the ribs and we rotate, what happens is, if we're gonna rotate to the left, on that right side, those ribs want to internally rotate, and they'll also give you a little bit of flexion. So they'll be coming out a little bit. But on the left side, they're going to be doing some external rotation, and they go into a little bit of extension. And where we find that people get stuck a lot of times is in that extension part, in that rotation, in that extension. And when we work on people, we do a lot of mobilizations that can help open that up and improve that mobility pretty quickly. But there's also things that you can do at home. There can be some stretches that you can do that can help stretch things on the inside of those ribs, because there's all this fascia and structures on the back, on the inside of the ribs, and that's kind of what we're going to be doing today. The other thing that happens is we have patterns. We have patterns with things that we do, movements that we make, that we're doing regularly throughout the day, throughout the week, whatever the case may be. And so think about it, how I describe what happens and how these joints start kind of getting stuck, and how even the way we breathe and where we breathe into will go in and have kind of similar patterns where there's just not a balance between side to side. And it's kind of like if you go outside and you walk in your yard and you walk down the same path over and over and over again, you'll start noticing that there'll be a pathway that you've created from walking there again and again and again. Well, the same thing kind of happens within our joints. They just, if we're always moving in a certain way, you'll create these pathways and the joints kind of get stuck. Versus if you're in your yard and you go down this path and then this path and then this path and then that path, you're going down different paths all the time. That's kind of like us moving in a lot of different directions so that our joints will be more fluid, so that we won't have any of these divots and these patterns. That's essentially what happens in our body when our joints kind of stiffen up. And the thoracic spine is not any different. So we're going to show you two exercises that can help kind of open up the space to where we're going to be stretching the inside part of the ribs, but we're also going to be breathing into different parts of the ribs that tend to get tight, because again, it's the same way. We kind of breathe, we're not equal on both sides, so our body will take the path of least resistance, and we'll kind of breathe the same way, where parts of the ribs may not be moving because you're not breathing in some of those sections. So it's going to be doing two parts. We're going to be breathing to get more air into certain parts of the body, but we're also going to be stretching the back part of the inside of the ribs to kind of help it be able to move again. So the first exercise is going to be basically stretching evenly. So if we just want to just kind of stretch everything evenly, then this is what we're going to do. And you're just going to get a little band and you're going to put it around your elbows, and we're going to put the arms up onto the wall. And what we're going to do is we're going to push through the wall. So you're pushing the forearms into the wall as you round out, kind of protracting those shoulder blades. So round out the back. So we're not rounding out like this. We're just rounding out at the very between those shoulder blades. Now what I'm going to do is, I'll show you here because it's a very slight movement. When I inhale and then I exhale, I'm going to be moving my arms out like this, but they're not going to be moving that much. You're not going to really see that movement, but that's the movement that we're going to be doing. So what you'll do, again, protract, inhale, and then exhale. and then inhale, and then exhale. And then inhale, and then exhale. So you'll be doing that, and you'll do about 3-4 rounds of breath and then relax, and then you'll do probably 3 to 4 sets of those, and you're trying to stretch the back part, get the air to go into the back part of your back to really kind of open things up back there. So each time you pull out and you're retracting, you're trying to hold that and then retract a little bit farther. Pushing into that, trying to get that back part of those ribs to really round out. This will really, again, help those ribs starting to move more fluid, help our air go into parts of the thoracic spine that it's probably not getting air into, to really improve this mobility. Now, the next exercise that we're going to do, we're going to be on all fours. So this is going to help with that. Remember how I said that rotation piece? One part of the ribs will go down, the other one kind of comes up. And so we're going to be in kind of a rotation position. So I'll have one hand down and one hand on like a block. So we're already kind of in that rotated position. And then what you're going to do, again, you're going to push up and round out through the mid part of the back, kind of the shoulder blade part. So we're not really arching like this. We're just really pushing up and protracting. And you're doing the same thing. You're going to inhale, and then you're going to exhale and push up. And inhale, and exhale and push up. So we're really trying to push through the hand that's on the table as we're just trying to breathe through and really round that part out so that we can help those ribs be in better positions, as well as getting the air to the back side of those ribs. And you'll do the kind of the same thing. You're going to breathe about through 3 breaths, take a break, and do 3 to 4 of those. And then really, doing those 1 to 2 times a day, and then really start noticing that things can actually open up. If you're noticing that, gosh, this is not really helping, definitely you want to get in to see someone that might be able to help you, because we find that when we can do some manual work on people, we can really progress people so much faster and getting things moving and helping you feel your best. So give these exercises a try. Again, if you like our information, make sure you subscribe to our channel. We're putting content out all the time. If you go in the description, there's a lot of other videos that you can watch and learn on this topic, as well as other resources like my book that I got published last year, where it gives you a lot of good education on kind of how we feel pain, and how in our medical system we're really treating a lot of different symptoms, and we're not getting to the source of the problem, and going into different body parts and kind of what happens in those body parts, like different sources of pain that we can feel, where they're coming from in those body parts. And I do it through stories. So make sure you check that out as well. You can buy that on Amazon, and we will see you next time.